In this video today, I will show you how well the Aurezzi 24 karat gold plated toothbrush cleans my teeth. I'm Rick Buck. I've been a dentist for 14 years. I like to cover all things oral health related, so subscribe if you have teeth and care about your health. In this video today, I will show you how well the Aurezzi 24 karat gold plated toothbrush cleans my teeth, while I explain what I like and what I don't like about it. And let me just tell you right now, what I don't like about it is the cost. But let's start how I always do, by staining all the plaque in my mouth pink. Then I'll show you the before results, and then brush for 2 minutes with 30 seconds in each quadrant or fourth of my mouth, all along explaining what I like and what I don't like about the toothbrush. Now, if you are brushing with this brush, it is likely because you want to either look or feel like a high roller. And if that is you, have at it. Right now, this brush is $82 from the link below. And you can get this with white or black bristles. But let me tell you, the main thing I don't like about almost all manual toothbrushes is that they don't have a timer on them, which you may think is fine because you can just download a timer app for brushing teeth. But over time, people just don't use those timers that they download on their phone, and they slip into the habit of brushing less and less amount of time. At the end of this video, I will link to a video that will show you the results if you brush for various times less than 2 minutes. And you can see how much plaque is removed in 20-second increments, if you brush for 20 seconds or 40 seconds or 1 minute. And you can see the results of brushing less amount of time than 2 minutes. Now, as I'm brushing here, I'm using the modified Bass technique to brush my teeth. Well, a lazy modified Bass, because I'm not doing it 100% well. Now, what is the modified Bass or modified base, however you want to say it? It is the ideal way for brushing with a manual toothbrush. And let me explain the steps for using the modified base. Place your toothbrush at a 45-degree angle to your gum line. That's so the bristles get under the gums when you brush. Then you brush 2 or 3 teeth at a time while using gentle circular movements. You brush each tooth with those circular movements, and then you flick the toothbrush down the teeth away from the gum line. And don't forget, you have to do this for all your teeth and all the surfaces. So you move your toothbrush a little bit forward to the next 2 or 3 teeth, and you do this all across all your teeth, both the outer, inner, and top surfaces of the teeth. To me, it's easier just to use an electric toothbrush, especially if you are paying this much for a brush. You should watch my video on the best daily brushing and flossing routine on how to get spotless results every day when you brush and floss. So now let's look at the results. Okay, so we see a moderate amount of plaque left behind, but the plaque left behind may look different than you would see plaque left behind with a mediocre electric toothbrush, let's say. Let me explain why. So in the midline on the top teeth, you can see it just didn't get that spot well at all. But now let's look at some of the other spots. The other spots that we kind of missed or that you can see look more faint than you would see with a brush that couldn't reach a spot. So the problem isn't that this didn't reach some of these spots, it's something else. Look at the upper right lateral incisor. It looks as though the brush did kind of hit and touch that spot, but it didn't completely remove the plaque, as you would see with good toothbrushes. And just so you know, there's an affiliate link below this video for $30 off my favorite toothbrush. Anyway, you can see the faint pink plaque spot left behind and lots of spots on the lower first molars as well. The upper right first molar, the lower right canine, and even the easy to reach front surface of the upper left lateral incisor. Oh, and I think I see some other spots faintly on the front of the lower left central incisor if you look closely. These faint spots are the issue when your toothbrush has bristles that are flat and they're all the same length. The reason why it's not completely removing the plaque and just kind of brushing over it is because the plaque in those spots are in small, tiny concavities. And if your toothbrush has flat bristles, it's not gonna reach in between there. But if the bristles are different lengths, it will get more in between those small concavities. It just misses too many spots if all the bristles are flat. That's why you see so many toothbrushes with different length bristles. And it's not thorough on plaque cleaning if your bristles are like that. And once again, I will put affiliate links to this brush, also my favorite brush and all my favorite dental products, and most importantly, my favorite floss below this video. And the reason why that's important is because while this toothbrush might be leaving lots of plaque behind, those exposed surfaces aren't the biggest issue. The biggest issue for your teeth is mostly in between the teeth. Most toothbrushes get adequately enough the exposed surfaces, but it's those surfaces between the teeth that toothbrushes miss that a floss needs to get. And so it's very important to have a great floss as opposed to a great toothbrush. So like and subscribe if you have teeth, and watch that video on getting the best daily brushing and flossing results below now.